Hello everybody, welcome back to my YouTube channel Mission OED. In this video today I'm going to discuss about how to score B in listening and more than B. Hope some strategies are there. Let's get started with this video. The first step in listening is be familiar with the listening module and understand the structure. As we all know that before starting with anything, it is very important to strengthen our basic things and make a strong foundation. So likewise, you have to understand the listening module. In coming slides, we're going to discuss about part A, B, C in depth, and before that, the thing is that the lot of candidates face issues such as getting lost and losing the audio track, loss of concentration, missing the some important information. But don't worry, I'm gonna help you with some of the strategies which would be helpful for you. Let's get started. Part A consists 24 questions to extract in total, and extract 1 is having 12 questions. You will listen to medical consultations and complete the notes here. Each extract is having 12 questions. In total of set, you have 24 questions. You may be gonna hear consultation between the physiotherapist, he may be a doctor, he may be a GP or neurologist, any type of doctor, and they're gonna have a discussion or medical extract with the patient. The next one is part B. You're gonna hear 6 questions. Audio probably last up to 2 minutes for each questions. But thing is that before starting the each question, you will have a minimum 10 to 15 seconds to read the question. And in this, you have 6 short extract, and it's like a multiple choice questions, and you have to grab any one correct answer. As you all know that part C consists to long extract, and you will listen to long extract and multiple choice questions, usually a presentation or an interview, and then as multiple choice question. So it is important to prepare wisely. During our preparation, we usually get 90 seconds, but trust me, we will get more than 90 seconds to read the question. So basically, utilize your 15 to 22 seconds for each questions effectively. In this time, you're gonna decide yourself that which one is suiting the best answer for your question, and it will really help you to find out the very important and correct answer as you predict. The step 2 is have a quick look or preview all 12 questions before the audio start. I'm speaking about part A. Before the audio start, you're gonna get 30 seconds to read. This is the golden period to decide your answer, to guess or to identify what is going to be takes place in the blank. So prepare this time very wisely and predict the answer, and be familiar with the words, frequently used words in the listening, and try to guess the answer. The step 3 is learn to predict the answer, and I hope your guessing power is not going to work every time, but it's luckily it works for someone, whatever. But thing is that predict the answer, you have to predict if it is a signs and symptom, just predict what may be the signs and symptoms. If it is a neurological extract, just predict what might be the conditions or what might be the diagnosis, what might be the signs and symptoms, what may be the treatment. So this is how we have to predict based on the As we all know that focus is the best thing ever. Listening overall 45 to 50 minutes, it needs pure concentration. Uh, I mean to say that if you put your 100% effort, 100% of concentration, definitely you are able to answer all the questions. It's not a difficult exam. Step 5, as I mentioned here, learn to move on, is it simply mean that jump to next answer. Sometimes the thing happen is you may be missing, you're gonna miss some of the answers like fourth answer, fifth answer, but don't worry. If you got missed one chance, there are 23 questions or 23 answers are waiting for you, so don't waste your time in simply trapping out for last question or last answer. Just try to move on. Hopefully you will get the better answer forward. Step 6, it is very important to be familiar with the frequently used medication, diagnosis, diseases, signs and symptoms, and many more things. I made a video previously in Mission OET about frequently used medication and disease condition, signs and symptoms, some sort of fruits, vegetables, type of place. So just go and see that. Hopefully, it would be better for you. Be quick enough while doing writing the things in the listening, because audio will never stop till 45 minutes. So make your decision very quickly after listening to the audio based on the flow, and it will definitely it is going to help for your reading writing module. So it is very important to practice effectively writing and neat handwriting. It doesn't mean that you can use even alphabet, capital letters, small letters, that doesn't matter, but you need to be perfect with your answer without any spelling mistake. Avoid errors. What we need all is practice effectively, and more. As much as you practice every day, definitely consistent practice is enough for clearing your listening exam. So I highly recommend you to practice every day with consistency and hard work. To improve listening, listen to podcast and listen some news which is in the, basically in the English language. And simply listening is not enough. Try to understand what they are speaking, try to understand what the words they are using, try to grab those words. It is very important. Simply listening, listen with skill. It is very, very important. As an aspirant in the journey of OET, it happens not every time our mental capacity and your and our mood is stable. But don't worry, keep your mind healthy and with positive vibes. Avoid the negativity. Don't worry if you got the less score. Definitely one or the other day you will crack your exam and you will come up with a lot of strategies if you do the frequent practices. And thing is that don't try to give up. If we are dreaming about it, definitely you can grab that dream. Okay, it is possible. Thank you.